back to the Dentist News Network. I'm Scott Drake, and I'd like to welcome back my guests, returning Dr. Kyle Gawrys and Dr. Ryan Wade. Welcome to both of you.
Thank you.
Dr. Wade, I'll start with you. How is your work and your orthodontic residency program going?
The residency program is as busy as ever. I've been to a lot of lectures recently that have passed through the Las Vegas area, and still looking forward to graduating soon. Well, in 2014, I'll be moving back here to Scottsdale and joining my father's practice.
Dr. Gawrys, what do you tell your patients about avoiding tooth decay and other problems during the holidays?
Right. Well, I know, this time there's constant snacking and parties with food all over. So an important point to remember is that you don't want to snack all day long. This continually introduces sugars and bacteria, which then collect and build up on your teeth. So it's actually better if you can, just have a snack, a meal, and then brush your teeth and be done. Another point to remember is that foods can be separated into those that have a high caries rate and a low caries rate. So the ones that you want to try to limit or avoid are the high caries rate. And these foods have high fermentable carbohydrates, such as your sugars and your starches. They include your crackers, the potato chips, the cookies, the candy, etc. However, the foods that you want to choose more have the low caries rate, and these are mainly your proteins. So peanuts, cheeses, some vegetables, more of your meats. So if you can stick to that side, you'll be in good shape.
Dr. Wade, talk about patients with braces. Does the same thing apply? I would imagine it would.
Yes, that's correct. The same does apply for patients with braces. However, they also need to be careful and avoid those really crunchy and tough foods, as well as the real sticky, gooey foods. So stay away from the peanut brittle and the Laffy Taffy and caramel during these times. These types of foods can damage the braces by bending wires and causing brackets to fall off, which will prolong treatment.
What other recommendations do you have for people with braces?
Well, patients with braces have the challenge of keeping them clean. Braces do act as a food trap, so they have to work extra hard to remove all the food and debris after every time they eat. So we always give our patients a travel toothbrush they can take with them no matter where they are. Even if they don't have toothpaste, they can still brush just with water to help remove any food after eating. Also, it's important to have really good technique. A lot of patients have trouble cleaning the area above the brackets and in between the gums. This area is prone for a lot of food and inflammation. So we work with our patients to improve cleaning this area. And we also recommend that all our patients use a water pick. This will help ensure they have a nice, clean, healthy smile.
So when you talk about using the water pick, do people still need to floss?
Well, I get that question a lot, and you still do need to floss daily. The water pick works great for removing food and debris that's on the surface, but it can't get down in between the teeth like floss can. So we still have our patients floss every day. And they can use items such as a floss threader, which is basically like a little stick with floss tied on it, and that'll help get underneath the wire that is in the way for regular flossing.
I've noticed many over-the-counter teeth whitening products. Do you guys recommend these products, or is it better to seek a professional?
I get asked a lot about whitening all the time and the various products that are out there. One of them is the mouthwashes. These mouthwashes, they aren't concentrated enough to really whiten, so you can definitely use them to have as a basic rinse, but for whitening, I wouldn't recommend it. There are also the toothpaste that will whiten. These do help because they contain abrasives, which will actually remove the surface stain of your teeth. So it's more removing stain, not so much whitening. Another option are the whitening strips that you can get at your local store. Some people have good luck with these, some people don't. They can just kind of vary person to person. But one option that seems to work well for most people and that I would recommend are the custom whitening trays. You actually go to your dentist and he can make these whitening trays for you, and then you have whitening gel that you can take home, fill the trays with, and wear those overnight or for a couple hours a day, and most patients see improvements with that method.
Well, finally, Dr. Waite, talking about, again, patients with braces or about to have braces, is it better to have your teeth whitened before or after orthodontic treatment?
It's best for patients that are going to start orthodontic treatment to wait until after they've completed straightening their teeth. And the reason is if you're making custom trays, obviously you want to wait till the teeth are set where they're going to be, otherwise the trays won't fit once you've completed your braces. Also, for those people using the strips, when the teeth are more lined up, they seem to have better luck with the whitening strips sticking on the teeth. So what you can do is avoid foods that stain your teeth while you're in braces, such as red wines and coffee and tea. And that'll help keep your teeth nice and white until you can get them bleached after treatment.
Once again, my guests have been Dr. Kyle Gawrys and Dr. Ryan Waite. Thanks to both of you.
Thank you.
Thanks for having us.
I'm Scott Drake. You're watching the Dentist News Network.